Hello everyone, welcome back to my channel. This is Sagnick Dutta. I'm a second professional MBBS student at Bardwan Medical College and Hospital, West Bengal. So this is the fourth video of this series of hematology, and in this video we'll be talking about blood groups and blood transfusion. Now, what are blood groups and why is it necessary? Now, blood group is basically a population characteristic. What I mean by saying population characteristic is, if you check out within your family members, you may or may not find all of the blood groups present in a single family. But if you go out into the society and take a major chunk of a population, you will find every single blood group present. So basically, blood group is a population characteristic. All the varieties of blood groups are present within the population, which may or may not be present within a particular family. So there was this scientist named as Karl Landsteiner, who in the year 1900 actually discovered the first ever blood grouping system known as the ABo blood grouping system. From then, 20 different types of blood grouping system has been discovered. For example, the RH blood grouping system, the Duffy-Lewis blood grouping system, Kell blood grouping system, and M and N blood grouping system. In practical application, all these blood grouping systems are used depending on the situation and the need of the hour. For example, the M and N type of blood grouping system is used in case of paternity disputes. But out of all these blood groups, the most common type of blood group is the ABO blood grouping system that is being used. Along with the ABO blood grouping system, the RH blood group system is also used very frequently. So now let us discuss about the ABO blood grouping system in detail. The ABO blood grouping system is the most common used blood group, and it is basically based on the presence of the antigen and the antibody in the human blood. These antigens are present on the RBC membranes, whereas these antibodies are present in the plasma. Basically, it is the antigen which is present on the RBC membrane determines the blood group of the individual. If the antigen present on the RBC membrane is A, then it is the person having A blood group. If the antigen present is B, then it is B blood group, and if the antigen present is nothing, it is nil, then it is said to be having a blood group O. And if the person has both the antigens A and B, then it is said to have a blood group AB. Now, these antigens are also known as agglutinogens. Now, talking about each of these blood groups, if we talk about the person having a blood group A, he or she will not have the antibody against this antigen A in the plasma. Now, if we talk about the antibodies which are present in the plasma, the person having a antigen A will not have its corresponding antibody in the plasma. That is, it will not have the anti-A antibody in the plasma. Consider a person having the antigen A, that is his or her blood group is A, then he or she will have the anti-B antibody and not the anti-A antibody. The anti-B antibody is also known as the beta antibody, whereas the anti-A antibody is known as the alpha antibody. As the antigens are known as agglutinogens, similarly, the antibodies are known as agglutinins. Now, when we have seen the basic concept of the ABO blood grouping, let us discuss the laws given by Landsteiner. Talking about the Landsteiner's law, there are two different laws of Landsteiner based on which this ABO blood grouping is done. The first law basically states that if the RBC membrane has got a specific antigen, its corresponding antibody shall be absent from the plasma. For example, if a blood group A person has the antigen A on the RBC surface, he or she will not have the anti-A antibody. It would be absent from the plasma, but the anti-B antibody will be present. The second law states that if the antibody present in the plasma, the corresponding antigen will be absent from the RBC membrane. For example, if the plasma has got the anti-B antibody, then the B antigen will be absent from the RBC membrane. Based on these, the ABO blood grouping is done. Now let us just do the ABO blood grouping. Now let us make a column about the blood group, the antigen present, and the antibody present in the plasma. If I talk about the blood group A, the person will have the antigen A, and in the antibody section we will write that it has the anti-B antibody in the plasma, or simply beta antibody present in the plasma. If the person has a blood group B, then the antigen present will be B and the antibody present will be the alpha antibody or the anti-A antibody. If the person is of blood group AB, then the antigen present will be both A as well as B, but there will be no antibody present in the plasma. And number 4, if the blood group is O, then the antigen present will be nothing. There will be no antigen present on the RBC membrane in case of a person having O blood group. But the antibody will be both alpha as well as beta. Now, based on these, we can summarize the concept of universal acceptor and universal donor. Now, if we look carefully into the person having blood group AB, he or she has got the antigen A as well as B, but it doesn't have any antibody to restrict these antigens. So, this person can have blood from any source whatsoever it might be. That is, they can accept blood from A, B as well as O blood group persons. Thus, the AB blood group persons are said to be universal recipients. Similarly, if we talk about the persons having the blood group O, he or she has got both alpha and beta antibodies present, which will fight back against the antigens. Thus, it won't be able to take up blood from any of the other 3 sources. It will only be able to take blood from a O blood group person. But it will be able to donate blood to all these 3 of the blood group. Thus, the O blood group is known as universal donor. Now, let us talk about a very atypical blood group which is very rarely found, known as the Bombay blood group. Now, talking about the Bombay blood group, it was discovered in the year 1952 in Bombay, India, and thus its name is Bombay blood group. Now, what is different in Bombay blood group from the other persons of other blood group? The genetic composition of the persons of Bombay blood group is a little different. Till now, we have discussed about the ABO blood group and we have talked about 3 antigens, that is A, B and O. That means nothing. But apart from these 2 antigens, A and B, there exists another antigen, that is the H antigen, which is usually present in all 3 of these, but is absent in case of the Bombay blood group persons. Thus, the Bombay blood group persons are represented as OH. We'll come into the details of this representation, why is it so, but they are represented like this. Now let us understand. For example, the person has got an A gene, he or she has got a H gene, and he or she also has got a B gene. Now, this H gene forms the H product. The B gene, with the help of this H product, forms the B antigen. And A gene, with the help of this H product, forms the A antigen. Now, this H antigen is present in the blood group O as well when this H gene or the genotype of the blood group O is HH or H small h. If the genetic composition becomes completely recessive, that is small h, then he or she is termed as having the Bombay blood group. What is the typical characteristics of these blood group person is that they have got no antigen on their RBC membranes, that is they do not have the A antigen, B antigen as well as the H antigen, but they has got all the three antibodies, that is anti-A, anti-B as well as anti-H antibodies in their serum. Now, what is the cause of this blood group? The main cause of this blood group is due to the mutation of the FUT1 gene present on the H locus. The frequency of occurrence of these type of blood group is very rare, around 0.0004%. Thus, the genotype of the Bombay blood group person is small h, and that is why it is represented like this. Now let us talk about the second important system of blood grouping, that is the Rh system of blood grouping. The Rh system of blood grouping is basically based on the presence or absence of the Rh antigen. The Rh antigen is present in most of the cases and most of the individual. So we will find most of the individual being Rh positive. About 85 to 90% of the population have got this antigen. But Rh negative is present around to 5 to 10% of the population who do not have the Rh antigen. These Rh antigens are of 6 types, namely capital D, small d, capital C, small c, capital E, small e. Total 6 different types of Rh antigens are found. Out of these, the capital D antigen is found in almost 70 to 80% of the individuals. Now, a very serious clinical condition called as the erythroblastosis fetalis, also known as the hemolytic disease of the newborn, might occur in the newborn babies due to Rh incompatibility. Let us discuss about that. Now, let us talk about erythroblastosis fetalis. This is also known as the hemolytic disease of the newborn. This disease is caused due to Rh incompatibility between maternal blood and the fetal blood. Let us understand it clearly. For example, the mother is Rh negative. That means she will not have the Rh antigen in her blood. Now she gives birth to her first child, and the child turns out to be Rh positive. Thus, this child will have the Rh antigen. Usually, the fetal blood and the maternal blood remains separate. But during the delivery of the baby or during any surgical procedure, fetal blood may come in contact with maternal blood. As a result, what will happen is the maternal blood will develop some antibodies against this Rh antigen. Thus, the maternal blood will now have Rh antibodies against this Rh antigen. Now, when this mother gives birth to her second child, if that child turns out to be Rh positive again, then this child will have Rh antigen. Now, the maternal blood has got the Rh antibodies against this Rh antigen, which will then attack these Rh antigens of this second child. As a result, this child will turn out to be diseased, known as erythroblastosis fetalis. The common symptoms of erythroblastosis fetalis are anemia, jaundice, and some renal failures. As a treatment, what is done is the anti-D serum is given to the mother after the delivery of the first child within 48 to 72 hours of delivery. Now, if a baby with erythroblastosis fetalis is born, he or she is done with exchange transfusion for anemia. When we have understood this process of erythroblastosis fetalis, let us think about something. Why is this known as erythroblastosis and not erythrocytosis? If the antigen antibody reaction is taking place, blood cells should come down, right? Blood cells should get destroyed. Then it should be termed as erythrocytosis. Why is it being termed as erythroblastosis? The reason is, as these blood is getting contaminated, there is formation of more and more immature RBCs. As a result, in the peripheral blood, more of immature RBCs will be found. Thus, this is known as erythroblastosis and not erythrocytosis. There can be another question, like why is only the Rh antigen and antibody is getting more prominence? Like, why is there no problem if a mother is giving birth to a child with a different ABo blood group? What is the problem in that? The answer is pretty simple. ABo antibodies are of IgM type. As a result, they cannot cross the placental barrier. But the Rh antibodies are IgG type. As a result, these can cross the placental barrier, resulting in erythroblastosis fetalis. With this, we come to an end of the discussion of the blood groups. Let us now talk about blood transfusion. Now let us talk about blood transfusion. What is basically blood transfusion? Blood transfusion means the transfer of blood from one healthy person to a person who needs that blood. That is basically blood transfusion. Now, in some cases, the entire blood transfusion is not needed or maybe is not suitable enough. At that time, what is done is some blood products are transfused. What are these blood products? The blood products are basically some different supplements. For example, the red cell transfusion, or fresh frozen plasma transfusion, or precipitate transfusion, or can even be platelet transfusion. This platelet transfusion is done in case of thrombocytopenia to prevent hemorrhage. Cryoprecipitation transfusion is done in case of hypofibrogenemia, where the fibrogen is less. What is done in case of cryoprecipitate transfusion is that the fresh frozen plasma is continuously thawed and the precipitate is taken out, and that becomes rich in factor 8, and that is then used and transfused. So these were about the blood products. Now, as the blood transfusion includes a donor as well as an acceptor, there should be certain conditions maintained when a donor can be said to be healthy enough to be able to transfuse or give his or her blood. Now let us talk about the conditions which needs to be satisfied before using a donor's blood. What is meant by the screening of donor is basically fulfilling certain conditions to be identified the donor as a healthy one. Now, what are the basic conditions? A donor should not be underweight. That is, his or her weight should not be less than 45 kgs. Secondly, his or her hemoglobin content should be normal or should not be less than 12 gram per TL. Third, he or she should not have had any infectious disease in the past 1 or 2 months. Fourth, and the most important, the person should not be suffering from any communicable diseases like HIV, AIDS, and etc. And number five, the donor should be of a sound mind to give his or her consent for the blood donation. Now, when we have actually collected the blood from the donor, there should be certain criteria, certain precautions, certain methods to be followed and applied to store this blood, because we do not use the blood as and when it is taken from the donor. It should be stored in a safety place following certain conditions so that it can be used in the future as well. Now let us talk about how is it stored. Now let us talk about the storage of the collected blood. Now how is this blood collected and then stored? We actually collect it from the cubital vein by using a 16 number wide gauge needle, and then we actually store it in a bottle. Mostly about 480 milliliter of blood is being collected, to which 120 milliliter of anticoagulant is added. Anticoagulant used is basically ACD, that is acid citrate dextrose. Now, this preparation of the bottle with 480 milliliter of blood and 120 milliliter of anticoagulant is preserved at around 0 to 4 degree centigrade of temperature, and then it can be used when necessary. Now, during blood transfusion, the major thing that needs to be judged is the matching of the blood between the donor and the receiver. That is actually the matching of the blood. Now, what we actually match is the blood groups. The most preferable condition is when both the donor as well as the recipient has got the same blood group. For example, a person with a blood group A positive can provide his or her blood to the recipient having the blood group A positive without any delay and without any problem. But in other cases, it needs to be judged properly. We should always keep in mind that a Rh positive blood can never be given to an Rh negative person, because it will then start preparing antibodies against the Rh antigen. Now, the major matching is the cross matching that is seen. Now, what is basically this cross matching? For example, the donor's blood has got cells as well as the plasma. The receiver has also got cells and plasma. Now, this matching of the cells of the donor with that of the plasma of the recipient is the major matching that needs to be checked, whereas the plasma of the donor and the cells of the receiver is a minor matching that needs to be checked. Let us explain why. The cells, if has got antigens which is against the antibody present in the plasma of the receiver, then it will create a havoc antigen antibody reaction resulting in some higher complications. But if the plasma of the donor has got antibodies against the antigens present on the cells of the receiver, it might not be such a harmful case or scenario, because these antibodies will get diluted in the 5 liter of blood present in the receiver. As a result, this matching the plasma of the donor with that of the receiver cells is said to be a minor cross matching. But this matching the cells of the donor with that of the plasma of the recipient is a major cross matching that needs to be checked. Now, when we have known about the matching, the checkings that needs to be done, and how the blood is stored, let us talk about the complications that can occur during blood transfusion, as well as what are blood transfusion orders. Let us discuss about that as well. Blood transfusion orders are basically the directions and transfusion orders which are given by the doctor to the recipient, determining the rate at which the blood should be transfused. It should be present at the recipient's prescription properly. For example, it might be written 20 drops per minute. That is, 20 drops of blood should be transfused within the recipient's body per minute. So basically, blood transfusion orders are the directives given by the doctor regarding the blood transfusion to the recipient. Now, repeated number of blood transfusions results in some complications and some hazardous implications in the recipient. For example, thrombophlebitis. The vein which is usually used for blood transfusion, due to repeated blood transfusion, that vein becomes swollen, and that is termed as thrombophlebitis. Now, due to some negligence, there might be infections caused by HIV and HB, that is hepatitis B virus, which might result in further complications. Due to blood mismatching, there can be hemolysis of the RBC, that is RBC destruction can occur. And number 4, in case of some elderly patients, due to these blood transfusion, this can result to congestive heart failure. So these were few of the complications or hazards of blood transfusion. Now with this, we have come to an end of this entire thing of blood group and blood transfusion. Hopefully this video was helpful to you. If it was, hit the like button, subscribe to the channel, and share it with all your friends and to the persons who might find it helpful. Thank you.